Good morning, Father, and all Edu Skills family members. My name is Nimi. I'm one of the OET aspirant in Edu Skills family. So welcome to the today's discussion, Occupational English Test. Before going that, I would like to say my sincere thank you to Father Sally, who is the one who made this wonderful platform for us to learn and grow OET and empower each other. So this is a very good non-profit platform. So we have our doubt and queries, all we can clear it from this platform. And I would like to say thank you to all Edu School admin members, those who are allowing me to present my presentation today. So am I audible?
Yes.
Yes.
So as we know, the Occupational English Test, OET, has a 4 subtests, which is reading, writing, speaking, and listening. So today's topic is about listening, part A. I think all of you know this part A as listening has also 3 parts, A, B, and C. So today's part is A. For that, what is our aim? Our aim should be on all are maybe thinking, I want to crack OET in band B. That was my thought also before I am joining this platform. But the father is the one who thought our aim, we should focus and practice for a band A. If we practice for the band A, of course, we can achieve our required score in OET. Finally, we can reach our dream destination. So we have to prepare and study for a band A in each module. Then for the listening. For the listening skill, how we can improve the listening skill? The first of all, in any module, we need patience, enough time, don't rush for taking exam day, before confident, and consistent practice and concentration. Concentration is most important for listening. As we know, if there is any small distraction or something, it will disturb our concentration. It may chance to lose our answer, and it will affect our total score. So concentration, while doing the practice, we have to develop the concentration. Try to listen in the podcast, help talk, and one-on-one interviews, debates, or whatever it is in English. Try to listen. It will take time, but it's not an overnight process. It's take a long journey. And try to, while you are listening, try to listen in a different accent. For example, because OET is not only using for one accent, so try to listen in British and Australian, like that one. So it will help us to recognize pronunciation in different accents. And while you are listening, if there is any doubt or any pronunciation, it's not understanding, it's no problem. Take a book, write it down, and again listen the audio until you're familiar with that particular word or sentence. And if there is a listening and reading challenges going to our Edu Skill Telegram group, you can participate that one daily. It will also help to improve the listening skill. So let's move to exam format, part A. The part A has 2 extracts, extract A and extract B. Each extract has 12 questions, total 24 questions. This 24 question is very important in listening, because if the 24 answer is correct, it will easily to crack the OET in listening. By the practice, we can achieve this 24 out of 24. What is patient-led dialogue? This part A, this is a conversation between the health professional and patient. So there may be the conversation most of the time between 2 gender, for example, female and male gender, And sometimes if there is a same gender also, there will be a sound variation. That's maybe one may be high pitch and other may be low pitch. And most, so it will help to recognize the part of each person. And most of the time, the answer is coming from the patient mouth. But we have to listen for the health professional also. Sometimes there may be answer coming from the health professional also. Then 30 seconds to read the 12 questions before the audio begins. What's this? Because as I mentioned before, there is a two extract 1 and extract 2. Before starting the each extract, there is a 30 seconds to read and skim and scan the question paper. If we use this time effectively, it will help us to lead the answer. As we are in the health professional, so we can assume maybe this one is coming the answer. And before starting the audio, there will be a beep sound. If we hear the beep sound, it means next is coming for the audio, and we have to focus on our question. While doing the listening part, we need three skills, because at the same time we have to listen the audio, read the question paper and write down the answer. Then write the exact word or phrase as given in the audio. It means if we heard in the audio like a blood pressure, so maybe we will write BP. So this is not an exact word. This is an English language test. Is not assessing our knowledge. So whatever we are given in the audio, we have to write in the exact word. Then only we can score the mark. And if we are hearing MRI scan, so we have to write down in the MRI scan. No need to expand it. In the writing, in the listening, we cannot use any abbreviations unless it's not given in the audio. That means write the exact word or phrase as given in the audio. So now the beware of paraphrasing. Synonyms and synonyms language. I think you know about the synonyms and synonyms language. It's already mentioned in the father's video also. What's that? Synonyms and synonyms language, it means similar meanings. Because in the question paper and in the audio, may not use in the same language. They will use in the similar meanings. So we are aware about that one. If there is, while we are listening the audio, if there is a new word, the same, write it down in a book. So it will help us to familiarize with the word and weekly do the revision. So it will help for the it will help to memorize. It means similar means energetic, maybe having a lot of energy. Then not plus opposite, maybe it's less. The cloudy day, it's mentioned maybe sunny day. And not all, maybe it's in the audio we are hearing short. That means. Then the exam typos. Minor spelling mistakes are acceptable in OET listening. For example, if you write it's need 2L or 2T, instead of you wrote only 1L, as long as there is no interruption, distortion in the meaning or pronunciation, it will accept in OET listening part A. But it's better try to avoid spelling mistake. So next, how to skim the audio. Skimming for the synonyms and synonyms language. Paraphrase, as I mentioned, the same like before. Maybe it's written, patient has lower extremities has swelling. Maybe we hear it's a lower limb has swelling. So this means it's coming from the same. Answer is we can predict the answer from the same part. Then scale, modal verbs. I will explain it all. Chronological or time expressions. Name, device, disease, person, or organ. So the name also sometimes there is patient. The next answer may be the patient name. Or sometimes it may be patient has some problem, or it's doing to the investigation, for example, endoscopy. So it's coming from the device. According to the question, while we are doing the skimming and scanning for the 30 seconds, if we check the answer question paper effectively, so we can predict maybe it's coming for the organ, maybe liver, or maybe it's coming for the test, blood test or urine test, or some examination under the anesthesia or endoscopy, or some disease the family member has some. It means it's coming from the hypertension or diabetes. So that's the name. And comparison and contrast. What is that comparison and contrast? It means a same similarities between the different part. For example, the eyes and ear, both are organ, but the function for both is different. Eyes for the vision and for the ear for the hearing. So this is the comparison and contrast. And number and age. So sometimes maybe the patient has had diabetes since 2000. So the year is coming, or maybe patient age, maybe 16, or she's suffering from something 1 year. So this is an 18, like that one. And STEM words, it means why they have the problem or what is the cause of that disease. That then check for the keywords or phrases. So as I mentioned, for the scale means all, most, many, a few, or some, few. As we know, this all is not same. All is not same for the most, and the most meaning is not same for many. Many is not same for a few, and few is not same as the some or some. So it means all means total, maybe 100%. The most above 90%, and the many is 50. The meaning is different. It's using in the different contrast. So that's why the scale, it's important. We have to recognize the difference between the each scale. And for the modal verb, can, as we know about this modal verbs, can, the past tense is could, the function for this one, ability, possibility, permission, and present tense may or might, possibility, and should, the function for that one, advice, recommendation, suggestion, and must, necessity, obligation. This is the difference between the modal verbs. So what is this chronology and time expression? So this is all same like we can hear in the audio, last month, to begin with, or firstly, or finally, last, next, then. This is the chronology or time expressions. We can hear this one also in the audio. So listening strategies, what this one? Prediction and anticipation. What is this as prediction and anticipation? So for example, the patient complaint, back pain, or patient has back pain dash, or patient has a dash pain. It means maybe there is a chronic back pain or a thrombing back pain. We can predict that answer. So according to when we listen the audio, maybe our prediction is correct. So we can write, that is the one, prediction and anticipation. And be aware of paraphrasing, and be aware of synonyms, and be aware of collective words. What is this collective words? Collective words, smokers, birds, the same other example. The patient has swelling on the upper extremities, maybe it's given in the patient has swelling on arms or limbs. So this means the collective words. For this prediction and anticipation, we are using for the first method. What is this first method? F stands for forcing, and I stands for inquiring, R stands for reading, and S stands for speaking, and T stands for deliberating. Nothing but this is the, which means look the word before and after the blank. If there is a, as I mentioned before, same like if there is patient is working as an, then dash. So the article is important. After the an, we know there will be a vowel sound only will come. So maybe an accountant, or patient needed advice to do the test. So there is one article A, maybe blood test. Like according to the article also, we can predict the answer. And what's one more important thing, do not repeat the word. Just for example, ask patient is working an accountant, do not write an again. So because if we wrote the an again, it's coming an account. There is no word in an account. So this will be wrong. So we have to be careful about the repetition in the word. Then how to skim. For this 30 seconds, it's the important golden second. Skim for the section heading, subheading. It means maybe there is coming for family history or personal history or any disease condition. So we know if the audio is asking, what do you working for living? So it means coming for the occupation. The next answer is coming down from the occupation only. There is a one good thing for the OET listening. If the answer is going for the sequential order, it will not go back. And in case if you stuck in a one answer or you didn't get any answer, do not stuck there, skip that one and go forward. And if there is not enough time to write the answer, just mention some abbreviation for your knowledge only. Then at the end of the each session, at the end of the listening session, there will be 2 minutes. Do not forget, go back to the question paper again, answer sheet again, and erase the abbreviation what you write and expand the what you hear from the audio. For example, as mentioned before, same like blood pressure, you don't have time to write that time blood pressure, just write down their BP, then go back, erase it, and write it again, the what you hear in the audio. And the name and personal device, body parts, it's also patient name or device which is ultrasound scan or body parts, liver, kidney, like that. Abbreviations, as I mentioned before, abbreviations is not, unless it's not given in the audio, it's not allowed to use in the OET listening part A. And numbers. Sometimes there may be chance to misunderstand the number 6 or 60 or 16. If they said in 16, sometimes maybe it's 6 or 60. So we have to concentrate for the listening the number. And what is the difference between the person and percentage? This person, it will not say 8%, 10%. It's only 8% or 80%. The percentage, it's coming from high percentage, low percentage. Then search for the scales like all, most, many, or synonyms, cause, comparison and contrast, type, chronology and time expression, paraphrasing, or model words. So how to practice the listening part? Always remember, do the test under the exam condition. Even the practice also you have in your mind, this is my exam. How I will write in the exam? Continue with the same pattern. And if there is any answer you stuck or you didn't get, don't pause that time. Continue the audio. At the end of the audio, check your answer with the answer sheet and listen the audio again with the answer sheet and listen the audio with the script and repeatedly do it. It will help to improve your listening skill. If you listen one audio and got the mark maybe 18 or 12, so maybe that audio is easy, or maybe this one is difficult. Even there is one answer is wrong also, then also go back to the audio again and check why it's happened or what I need to correct it and find out the mistake. The self-analysis is very important in the OET. And refer to the key and identify the mistake. And pronunciation, different pronunciation, and if there is any new medication name, it's all write it down and study it. And record your score on self-assessment form. It's available in our Telegram group, and if you didn't find, you can message there. It will be available there. and listen to the audio again and again. Try to identify the answer and related strategy. This one, as I mentioned before, listen to the audio and read the script and find out the answer is how it's come and highlight the related strategies. And detailed analysis of the audio and script to understand the strategies involved. And analytically listen to the same audio repeatedly for a week. It means take one audio and it's a question paper and it's great. And do this one for 1 week. And you can do practice in the other audio also, but try to do in the one particular question for 1 week. It will help us to improve your listening skill. And try to do in the one part for 1 week, then go back to the other part. So for the introduction, for the listen the audio carefully from the very beginning itself, because it's placed once only. The beginning part contains the introduction with topic and its description. For example, it will say, you hear a conversation between the physiotherapist and a patient. So we can assume the physiotherapist, it's from the rehabilitation. The question may be coming from the rehabilitative side or gynecologist to the patient. So the gynecology related questions. So from the heading itself, we can assume maybe the topic is coming for this area, and listen to the general idea of the audio. So each extract before we have 30 seconds. So now the listening day 1, we are going, I'm taking for the 13 to 24 question. So are you ready to do the listen the audio?
Yes.
Yes.
You hear a senior obstetrician talking to a patient called Hilary Johnson, who has been referred by her midwife.
Hilary Johnson? Hi, do come in and take a seat. I'm Dr. Smith, and I'm a senior obstetrician here. So, Hilary, you've been referred to us by your midwife.
Mm-hmm.
I have her notes with me here, but could you tell me in your own words why you've been referred?
Oh, yeah, no problem. I think I've been referred to you because the midwife said she found some glucose in my urine sample and was worried about diabetes. If I understand correctly, I could have diabetes during my pregnancy, but if I do, it's not likely to continue after giving birth. I've noticed that I'm craving sweets and cakes all the time at the moment, and I've just been letting myself eat whatever. So I've put on a bit of weight, and I don't think it's all just baby weight either. I've never had a problem with diabetes before, and I'm hoping it'll turn out to be something else. My aunt actually has type 2 diabetes, but she's always eaten a lot of sugar, so I think that might be a factor. She just controls hers with diet now and doesn't have to take any medication.
Oh, okay. Thanks for letting me know. I see from your notes that you're 24 weeks pregnant now. How has your pregnancy been up to now?
Oh, I have been so lucky. I got the usual sickness early on. Well, stomach pain, but not actually being sick. I think that's pretty common. And it's settled after the first trimester. I've been taking some medication because I also had pretty horrible heartburn.
Right.
And it seems to take care of the problem. And also I've started to get a bit of back pain in the last week or so. I'd say it's like a throbbing feeling, but other than that, I've been pretty fortunate. I suppose I've been gradually getting more and more tired since the start of my pregnancy. I've just put it down to the extra energy my baby needs. But it could also be because I haven't been sleeping very well. Also, sometimes the nausea stops me from making something healthy for dinner, which is annoying because I know I need to eat healthily. I take a prenatal, though, to make sure I'm getting the right nutrition.
Well, it seems like you're managing to deal with most of your symptoms well.
Yeah, this is my first pregnancy. And to be honest, I didn't have a clue what to expect. But so far, so good. It's only this glucose thing that's got me worried. I imagine it's just a one-off, but I guess it's best to get it seen to.
Certainly, and I'm pleased you're here so we can get things sorted. So we'll need to book another appointment to carry out some tests.
Okay, so when will I have to have this? Because I'm a bit busy at work at the minute.
Well, ideally as soon as possible. Can I ask what you do for a living?
I'm a high school teacher, and it's just getting to that time of year when the kids are gearing up for their examinations. So I can't afford to be taking too much time off during the day. I'm actually a little bit stressed at the moment as well. I've had to do a lot more work over the past few weeks. I think it's just that time of year. I've been a teacher for 4 years now, so I'm starting to develop ways of coping with the madness. With that in mind, if our next appointment could be at 5-ish or later, then that would be perfect.
No problem. Just make sure to let the receptionist know your preferences. When we find sugar in preliminary tests, we offer an oral glucose tolerance test, which is what we'll do when you come in next. Do you know what that involves?
Well, I asked a few of my friends about their pregnancies, and my friend Beth said that she had the same thing and told me about that test. She said that she had to come into the hospital and drink a sugary drink and then have a blood test to tell if she had diabetes. Is that right?
Yeah, that's pretty much it. Here's the leaflet that explains the test so that you can have a read about it when you get home. Do you have any other questions for me?
No, I don't think so. I'll go away and read this and wait and see what the test says. Well, thank you for your help today.
You're welcome. I'll see you once we have the results and we can take it from there.
I hope all of you get the answer. So I highlighted here for the words, what we will check in the blank before and prediction. The glucose in dash indicator risk of diabetes and describe herself as sugary food. So she is taking something. She is describing noticed extract. So here is important, unrelated to pregnancy. It's not related to the pregnancy. And telling the family history. Has someone suffered from diabetes? And she has morning sickness. It's pain in some part of the body. And for control, some disease controlled with the medication. And she has a back pain. She is describing it's like maybe chronic or throbbing something and feeling increasingly the problem. It's disturbing her sleeping and concerned about diet, taking A. So we have to concentrate this taking A. Maybe there may be many diets they are telling, but after the word, this taking A, there is our answer is coming. Then the occupation. When we hear the occupation, it's assumed the next answer is coming down from the occupation only. Feeling, increase, and next appointment. Take an. This I mentioned this an article. So it will come only the vowel sound here. And has given the something given to her. The answer is the 13 urine sample and 14 craving, 15 weight and 16 aunt, 17 stomach, 18 heartburn, 19 throbbing, tired, prenatal, and 22 a little bit or stress is both correct, oral, leaflet. Then go back to the script. Conversation. The Hilary Johnson, the patient and the doctor between the conversation. Then here she is telling, she found glucose in my urine sample. So this is our answer, glucose in my urine sample. But the question, glucose in urine, it's indicate for the diabetes. Then I have noticed I am craving sweets and cake. But in the question, it's a sugary food. So it means come there, sweets and cake. So this is the food coming, craving. Then the next answer is coming. I have been letting myself eat whatever. So I have put on bit of weight and I don't think it is all just baby weight. That is the important their question paper. It's not related to the pregnancy. But here in the audio, it's I don't think it is all just baby weight. So it's not related to the pregnancy. Her weight is extra weight. Then there someone is family member is suffering from diabetes. That's her aunt. The 70, usual sickness. So the question paper, morning sickness. Morning sickness is the same as usual sickness. Then no stomach pain. She has the stomach pain. Then the next is controlled with the something medication. Here also she said, I have been taking some medication because I also had pretty horrible heartburn. So her heartburn is controlled with the medication. Then the next one, she has back pain. She's described that one. I would say it's like a thrombing. Feeling is thrombing back pain. Then this is the one I mentioned before. Maybe this one, there is answer is coming. Healthy for which is annoying because I know I need to eat healthy. I take A. There is the question paper taking A prenatal. So the answer is prenatal. Then there is between, there will be a conversation. No answer is coming from that part. Then the next answer, the health professional is asking, can I ask what you do for a living? So it means occupation. They are asking for the occupation. From here, the heading, subheading, occupation, all the answer is coming from down. High school teacher. So there is a secondary school teacher. I'm actually a little bit stressed. So this is the answer. Then as I mentioned before the article, here and. So the and after the vowel sound, oral glucose test. So we have to concentrate about this one. This one we can predict. Then the last sentence is, here is a leaflet that explained before the blood test, the doctor gave for her a leaflet. So thank you. I strongly recommend all of you to watch in the father's video in the Edu Skills YouTube channel. There is a detailed explanation about the OET part, subtest, writing, listening, reading, and speaking. It will help you to crack your OET and actively participate in the group discussion also. And thank you, Father, once again for give me this opportunity to share my learning experience with each other.
Thank you, Nimi, for your empowering attitude.
Thank you.
It was really a revision for us and it helped us a lot to revise with the listening part A. Thank you. And we are expecting more classes from you, Nimi. It was really nice.
Yeah, I will try to do.
Okay, friends, you have any clarifications, you can go on with. I can spare a couple of minutes for you if you want. Any concerns or clarifications? And I thank Nimi, wonderful. If you have some feedbacks, definitely for Nimi, you can carry on with your feedbacks. And it was great indeed, and you have done well.
Thank you, Father. It's all because of your support.
Now, this is what you require, this confidence you have to develop. And as I normally tell you that most of the students, I can bet you more than 50% of the students have the challenge not because they are not competent, but they go to the examination hall, they have the stress, examination fear, lack of confidence, they are not able to manage the exams. So now maybe Nimi will never ever forget these things. It is almost,
really.
It is engraved in our brain now. So whenever whenever she takes up a new material, that will become very easy. That's why we ask you to take up student-faculty sessions, whereby you teach others and discuss with others.
And Nimi, your class is very wonderful today.
Thank you.
Hi, Nimi.
Hi.
My name is Darish Varghese. Yes. Thank you, Nimi. You have explained very well.
Hi.
This is Divya Pinto.
Hi,
Hello,
Divya.
Nimi. Well explained. Thank you so much. Thank you so much for your effort.
Thank you.
Looking forward to another session.
Yes, of course, I will try.
Thank you. You have explained very well part A. This is very helpful for us. Thank you.
Thank you.
Okay. So this is the platform. Yeah, platform is of the health professionals, for the health professionals, by the health professionals. It's you all who run the platform. Like Nimi did today, you have to contribute, and that really complements your studies. Yeah.
I want to say thank you to Nimi for a nice class. Thank you for that.
Oh, great. Thank you. You're welcome. And also we remember Jalajam, who had taken this initiative. It was there, but she revived the student faculty initiative. She had taken a lot of trouble and supported by Manju Mole and this one, Lily Mole and Rajini and other admin panel members. So thank you as well. Now everybody can try this, okay? At least one session you take, you'll get a lot of confidence and clarity in your learning process. That clarity can never be given by any teacher. Once you teach, it's almost like 50 times reading, equal to learning 50 times.
I always hide my face, but today I have unmuted the video. I'm scared of you, Father, really. But
Me? You are scared of me, my goodness. I look so terrifying, right?
It's like, because I have not talked to you anytime, so I feel a bit of scaring to talk to you, to show my video.
Do I look terrifying or sound terrifying?
No, not like that, Father. It is due to a respectful fear.
Oh, that's it. There are different types of fears, right? Now fear is gone, right?
Yes.
Next time onwards, Selma will be speaking every day because her fear is gone now. Otherwise, I'll have to put instead of Saline Joseph, Saline terrorist.
Yes,
She wants to talk.
I'm first time to talk with you. I'm very excited. This first section is very useful for me. Okay, Father. Okay, Father. Thank you.
Greatest problems with I told you now, one is that you target B and you happen to get 340, 350, 330, 320, all those scores. And the second thing, you want to crack OET within 3 weeks, 1 month or 1.5 months. No, OET needs at least 6 months training. Minimum, I say, if you are competent enough, 6 months training. But never ever book the date.
Yes, that is true.
At least in reading and listening, I tell you, never ever book the date unless you get consistently above 34. Okay.
Okay.
Consistently means when you do 10 practices, at least 7 practices, you should get above 34. 1 or 2, maybe depending on the material or some unknown material can disturb you. Consistent means out of 10, 7 should be at least above 34.
Okay, thank you, Father.
Yes. And all the 42 answers are for you. No need to leave any answer. You can get even 42. There is no issue. Minimum is 34. Maximum is 42. And we want more of the volunteers to come forward and support the system and platform because, we have thousands of people. When you spare some time and support. Now today's session happened because Nimi sacrificed her time, convenience and all that, and the admin panel supported her. So, and also that has a process of learning, even yesterday she had a session with me about this session, me and some of the admin panel members. So that was a real learning. She will never ever have a concern regarding part A now.
Yes, sir.
Yeah, that's it. When you teach, you have that clarity in your mind. Otherwise, you think you know it. It's called the illusion of competency. You think you understood, but when you practice, you won't get it. It's called illusion of competency. Q&A session, you are supposed to unmute your video.
Thank you, Nimi, for your wonderful section.
Welcome, Chachi. Thank you for your support also.
Yeah, it was so, you did it very beautifully, and I think it will be helpful for all the aspirants, and thank you, Father, for your support and guidance for us. Then I have a request to all the aspirants. Please share your learning experience in the main platform to support the Nimi and other members. It will be encouragement and motivation for others to come to do these sessions. So please share your experience and all. And we are welcoming all of you to do these sections. So it will be a good experience for all of us. Okay, thank you, Father, thank you, Nimi, thank you all admin members.
Thank you, Father, and thank you, Nimi. You have done an excellent work. Okay, so you are an encouragement for others. Who is here? I request you all, please come forward like Nimi, and you can motivate yourself and others also. So if you take a chance, you never, like Father said, you never forget that session, which session you have taken. So try to do yourself. We all are here to help you. Father is always there to help to all of us. So please understand and utilize that opportunity. So please come forward, and hereafter we will have sessions every alternate days, in the sense 3 days in a week. So we can study along with the group also. So we please come and active in the main group along with other groups, so we can learn by helping each other. So I hope all of you will come forward and will motivate ourselves and will motivate others also. Okay. Thank you so much, Father. You are giving all these facilities to us.
Yeah, it's all the admin panel, empowering army, all work together. And Selma has put a good learning experience in the main platform. Congratulations. Good. Score from 23 to 38. That's great. Selma, right?
Yes, Father. Yeah, it was
good,
really helpful for me because
Just now
initially I was scoring very less, but now I could score after listening to the video and practicing along with the video. So it was very helpful, Father. I'm very thankful to you.
Great. No, that's how when you share your experience, others feel motivated as well. Yeah. Someone else?
Good morning, Father. This is Lisa Moore.
Yeah.
Thank you for this wonderful session conducted by Father and Nimi. Father, last week I sent a request to Vinci Chechi to add me also in the empowering army. I am also interested.
Okay.
So,
Manju Mol, take down the name, okay?
So please consider my request.
Yeah.
And also, I want to ask you when you will resume our Zoom. Yes.
Lijamol Kurvila. No, I conduct Zoom sessions depending on the concerns that comes in the mentors hour. 12 to 1 o'clock is the mentors hour. No? These days, I don't find any concerns over there.
No, our old Zoom classes, the one we were conducting, it was very beneficial.
Which one was that?
The one you stopped. You stopped the Zoom session now. The one we will have study group.
Oh, study group. Okay, study group. Yeah.
Yes.
Study group, you can ask Rajani. Study group. Copyright is with Rajani Biju. She is smiling from there.
Okay.
Yeah.
Can you add me in study group?
Yeah, Divya Pinto, Rajani. Yeah. You will have to just message Rajani so that she can get your contact, so that she can send you the message. Okay.
Yeah.
Even in Telegram, you can chat, you can send a text to her.
ഞാൻ പറയുകയാണെങ്കിൽ അച്ഛനെ കണ്ടുകൊണ്ടാ ഞാൻ ഈ ഗ്രൂപ്പിൽ ചേർന്നത്. അച്ഛനെ മാത്രം കണ്ടുകൊണ്ടാ. അച്ഛനാവുമ്പോ നമ്മൾ ആരും പറ്റിക്കപ്പെടില്ലല്ലോ എന്ന് ഓർത്തിട്ട് കണ്ടുകൊണ്ട് പിന്നെ കണ്ട് ഇഷ്ടപ്പെട്ടിട്ടാണ്. അച്ഛന് ദൈവം അനുഗ്രഹിക്കട്ടെ, ഒത്തിരി അനുഗ്രഹിക്കട്ടെ. ഞാൻ പ്രാർത്ഥിക്കാം. ഗ്രൂപ്പ് ഒക്കെ ഉണ്ടല്ലോ അച്ഛൻ.
ഇതൊക്കെ നിങ്ങൾ എല്ലാവരും കൂടെ മനസ്സ് വെച്ചാൽ ഉണ്ടല്ലോ, എല്ലാവരും ശരിക്കും ഈ പ്ലാറ്റ്ഫോമിൽ പഠിക്കാൻ വരുന്ന ഒരു മുടക്കൂലല്ലോ. 10 മിനിറ്റ് ഡെയിലി ചെലവഴിക്കുക, ഈ പ്ലാറ്റ്ഫോമിന് വേണ്ടി ചെലവഴിക്കുകയാണെങ്കിൽ നിങ്ങളെ എല്ലാവരും ഈസി ആക്കി പാസ്സാക്കി വിടും. നമുക്കിപ്പോ സിസ്റ്റമാറ്റിക് ആയിട്ടൊന്നും കൊണ്ടുപോകാൻ പറ്റില്ല. കാരണം എന്താ, ഇന്നലെ കയറുന്നവരല്ല ഇന്ന് കയറുന്നവരല്ല നാളെ കയറുന്നവര്. ആകെപ്പാടെ എനിക്ക് കോമൺ ആയിട്ട് ഓരോ സെഷൻ കിട്ടുന്ന അഡ്മിൻ പാനലിലുള്ളവർ മാത്രമാണ്. ബാക്കി എല്ലാവരും ഇങ്ങനെ വരുന്നു പോകുന്നു, ഇഷ്ടമുള്ളപ്പോ കയറുന്നു, ഇഷ്ടമുള്ളപ്പോ ഇറങ്ങുന്നു. അപ്പൊ നമ്മൾ എങ്ങനെയാണെങ്കിലും അവർക്കൊരു വലിയ ട്രെയിനിങ് ഒന്നും കൊടുക്കുക, സിസ്റ്റമാറ്റിക് ആയിട്ടുള്ള ട്രെയിനിങ് കൊടുക്കാൻ പറ്റില്ല. അവർ ഏതെങ്കിലും സെഷൻ കൂടുന്നു, അല്ലെങ്കിൽ ഏതെങ്കിലും വീഡിയോ കാണുന്നു, എന്തെങ്കിലും പ്രാക്ടീസ് ചെയ്യുന്നു. അതൊരിക്കലും സിസ്റ്റമാറ്റിക് ആകില്ലല്ലോ. സിസ്റ്റമാറ്റിക് ആയിട്ട് പോവുകയാണെങ്കിൽ വളരെ ഈസി ആയിട്ട് ചെയ്യാൻ പറ്റും. അങ്ങനെ ധൈര്യമുള്ളവരൊക്കെ എനിക്ക് മെസ്സേജ് ചെയ്തോ, ഇറങ്ങുമ്പോൾ ഒരു 10 മിനിറ്റിനൊക്കെ എനിക്ക് മെസ്സേജ് ചെയ്തോ, ഒരു ഗൈഡ് ചെയ്യുന്നതായിരിക്കും. നമ്മളിനിപ്പോ കുറച്ച് സെലക്ടഡ് ആയിട്ട് പോകാൻ പോവാണ്. കാരണം എല്ലാവരും ഇങ്ങനെ വെറുതെ എന്താ പറയണേ, കയറി ഇറങ്ങി അവർക്കും പ്രയോജനമില്ല, നമ്മൾ സമയം കളയുന്നതിന് പ്രയോജനമില്ല എന്ന് തോന്നുന്നതുകൊണ്ട് സീരിയസ് ആയിട്ടുള്ളവരെ മാത്രം പഠിപ്പിക്കാന്ന് വെച്ചിരിക്കുകയാണ്. കൃത്യമായ ടാസ്ക് ചെയ്യുക, ഫോളോ അപ്പ് ചെയ്യുക, സബ്മിഷൻ ചെയ്യുക, ഫീഡ്ബാക്ക് ഇടുക. നമുക്ക് ഇച്ചിരി കഴിഞ്ഞാൽ മേടിച്ചിട്ട്.
അല്ല, എനിക്ക് വിഷമില്ല എനിക്ക് ഒട്ടും വിഷമില്ല. എനിക്ക് ഭയങ്കര സ്കോർ കുറവാണ് കിട്ടുന്നത്. പക്ഷെ എനിക്ക് ഒട്ടും വിഷമമില്ല, സംശയമില്ല. എനിക്ക് കിട്ടും. എന്നിട്ട് ഞാൻ എക്സാം എഴുതും. അച്ഛനോട് പറയും എക്സാം എഴുതിക്കോളാൻ. അപ്പൊ ഞാൻ എഴുതും.
അതാണ് ആറ്റിറ്റ്യൂഡ്. കൺഗ്രാറ്റുലേഷൻ.
പക്ഷെ ആ വീഡിയോ ഭയങ്കര ഗുഡ് ആട്ടോ ഫാദർ. എന്താ വെച്ചാൽ അത് കറക്റ്റ് ആയിട്ട് ഫോളോ ചെയ്ത് പഠിക്കണെങ്കിൽ അത് കറക്റ്റ് ആയിട്ട് നമ്മൾ ഫോളോ ചെയ്യുന്നു. വേറെ പുറകിലേക്ക് പോവോ ഒന്നും വേണ്ട. ആ അച്ഛൻ ഭയങ്കര കഷ്ടപ്പെട്ട് ഇട്ടതായാലും ഭയങ്കര പഠിക്കാൻ ആഗ്രഹിക്കുന്നെങ്കിൽ നല്ലതായിരുന്നു.
ഇവിടെ ആരും പഠിക്കാൻ ആഗ്രഹിക്കുന്നില്ല, എല്ലാവരും OET കിട്ടണമെന്ന് ആഗ്രഹിക്കുന്നുള്ളൂ. പഠിക്കാൻ ആഗ്രഹിക്കുന്നവർ ആരും തന്നെ ഇല്ല. എല്ലാവർക്കും OET വേണം.
അച്ഛനിട്ട് ആ വീഡിയോ ഞാൻ ഫോളോ ചെയ്തിട്ടാണ് എനിക്ക് ഞാൻ ലേണിംഗ് എക്സ്പീരിയൻസ് ഇട്ടത്.
അത് നന്നായിരിക്കും. ലേണിംഗ് എക്സ്പീരിയൻസ് ഞാൻ ഇപ്പഴാ കണ്ടത്. പെട്ടെന്ന് മെയിൻ പ്ലാറ്റ്ഫോമിലേക്ക് ഒന്ന് പോയത്, അന്നേരം നന്നായിട്ട് ഇട്ടിട്ടുണ്ട്. അല്ല, ഞാൻ പറയുന്നത് എന്താ പറയാ, എന്റെ ഈ ഏതാണ്ട് 3 ദശാബ്ദത്തോളമുള്ള എക്സ്പീരിയൻസിന്റെ ഞാൻ പറയുക, സിസ്റ്റമാറ്റിക് ആയിട്ട് പോവുകയാണെങ്കിൽ നിങ്ങൾ ഈ പ്രാക്ടീസ് ചെയ്യുന്നതിന്റെ 4-1 പ്രാക്ടീസ് ചെയ്യേണ്ട ആവശ്യമില്ല, നല്ല സ്കോറും കിട്ടും. ഇപ്പൊ ഞാൻ പറഞ്ഞ അത് 7 സ്റ്റെപ്പ് ഞാൻ 70 പ്രാവശ്യം ഈ പ്ലാറ്റ്ഫോമിൽ പറഞ്ഞു തന്നിട്ടുണ്ട്. പക്ഷെ ആരും 7 സ്റ്റെപ്പ് പോയിട്ട് 3 സ്റ്റെപ്പ് പോലും ഫോളോ ചെയ്തായിട്ട് ഒരു ഫീഡ്ബാക്കിൽ ഞാൻ കണ്ടില്ല. ഫീഡ്ബാക്ക് ഇടുമ്പോൾ നമുക്കറിയാമല്ലോ ഫോളോ ചെയ്തിട്ടുണ്ടോന്ന്. അതുകൊണ്ടാണ് പിന്നെ ഞാൻ അറ്റ്ലീസ്റ്റ് അതൊന്ന് കാണിച്ചു കൊടുത്തേക്ക്, ആർക്കെങ്കിലും ഉപകാരപ്പെടുന്നോർത്ത്. അതുകൊണ്ട് ഇപ്പൊ സെൽമ പറഞ്ഞ അതേ ഫീലിംഗിൽ പ്രാക്ടീസ് ചെയ്ത് പോവുക, വളരെ ഈസിയാണ്. സമയമെടുക്കും. ഞാൻ പറഞ്ഞില്ലേ, പാർട്ട് A, ഒരു ലിസണിങ് പാർട്ട് A ചെയ്യാൻ ഒരാഴ്ച നിങ്ങൾക്ക് പിടിക്കും ചിലപ്പം, ഈ സിസ്റ്റമായിട്ട് പോകും. പക്ഷെ മതി, ഒറ്റ ആഴ്ച കൊണ്ട് പെർഫെക്റ്റ് ആയി. അങ്ങനെ 3 ആഴ്ചയും കൊണ്ട് അല്ലെങ്കിൽ 4 ആഴ്ചയും കൊണ്ട് നിങ്ങൾക്ക് ഒരു മൊഡ്യൂള് 1 മാസം കൊണ്ട് പെർഫെക്റ്റ് ആവും. അത്രത്തോളം ക്ഷമയുള്ളവർ എവിടെ?
വ്യാഴാഴ്ച ഇനി അടുത്ത സെഷൻ കാണാം.
അപ്പൊ നിങ്ങൾക്ക് താല്പര്യം, ഈ സെഷൻസ് വേണമെന്ന് താല്പര്യം ഉണ്ടെങ്കിൽ മെന്റേഴ്സ് അവരിൽ കൺസേൺസ് അറിയിക്കുക. കാരണം എന്നാന്ന് വെച്ച് കഴിഞ്ഞാൽ നമുക്ക് അത്യാവശ്യമുള്ള കാര്യങ്ങൾ മുഴുവനും ഞാൻ പഠിപ്പിച്ചിട്ടുണ്ട്. ഇനി അത് തന്നെ റിപ്പീറ്റ് ചെയ്യുന്നൊരു കാര്യമില്ലല്ലോ. അതിന്റെ വീഡിയോസ് ഞാൻ അപ്ലോഡ് ചെയ്തിട്ടുണ്ട്. അത് കണ്ടിട്ട് നിങ്ങൾക്ക് മനസ്സിലാകാത്ത കൺസേൺസ് ഒക്കെ ഉണ്ടെങ്കിൽ ആ വീഡിയോ റെഫർ ചെയ്ത് ഇടുകയാണെങ്കിൽ ഞാൻ അത് അതേപോലെയുള്ള വേറെ മെറ്റീരിയൽ എടുത്ത് അതേ പ്രശ്നങ്ങൾ സോൾവ് ചെയ്ത് തരും. ഓക്കെ അല്ലേ? ഓക്കെ, നമുക്ക് പിരിയാം. Bye. God bless you.
Thank you, Father. Bye.